Right, back on the local front, given the latest worrying COVID-19 related numbers, there are questions about the possibility of a rollback in the easing of social restrictions here on the local front. And to answer these questions, I have Kim Yeon-seung up next. Yeon-seung, welcome back.
Thank you for having me.
Right, so I hear officials have acknowledged the role played by the recent easing of social restrictions in the latest jumps in COVID-19 tallies here in the country.
Well, Sunhee, if you look at the current trends, you can really see that the COVID-19 infections and the ease measures go hand in hand. So health authorities say that the easing of measures are partly to blame for the latest surge. So if worst comes to worst, they may pull the plug on the gradual lifting of restrictions. But for now, the government is sticking to its current COVID-19 strategy, but it's keeping a close eye on several warning indicators to make sure that the country doesn't reach a breaking point. Take a listen to what they had to say.
We're going to comprehensively look at 5 key indices like ICU beds and weekly critical cases, among other data. If the country reaches dangerous levels like the ICU beds fill up to more than 75%, we will look for the main reasons behind that and react quickly.
They said that they're going to look at 17 indices in total and make a weekly assessment of our COVID-19 situation, graded on a scale of 1 to 5, as you can see here, with 1 being very low in terms of danger levels and 5 being very high. Right now, they said that the nationwide threat level is at level 2 or low, while the capital city is at level 3 or moderate.
Right. And Yeon-seung, how will these alert levels, so to speak, factor into the government's decision regarding social restrictions then?
Right. So health authorities will take these threat levels into account when they're determining to whether to make the changes in their gradual easing of COVID-19 measures. So every 4 weeks or so, they will compile the relevant data and decide if the country can move forward with the planned easing or if it needs to switch course. If they believe that infections and critical cases have reached a critical point, they might pull the emergency brakes and follow a contingency plan that directly targets the source of the outbreak. They have yet to share the details, however, on what that plan would entail.
Right. So Yeon-seung, as of now then, the nationwide threat level stands at low and the threat level here in the Greater Seoul area stands at moderate. Does that mean that the current situation is within our medical capacity?
Well, Sunhee, let me quickly fill you in on where we stand as of now. So there's almost 80% of ICU beds filled in the Greater Seoul area, and more than 60% are occupied nationwide. Even with the majority of the beds occupied, authorities said that the situation is still manageable, and they were going to secure as many beds as possible to accommodate the growing number of patients. Prime Minister Kim Yeon-seung will actually also meet with hospital directors in the capital region to discuss their healthcare plans and to make more ICU beds available. But see, securing the extra beds will take several weeks, and even if they're successful in their attempts, there is still the looming question of, are there enough medical workers to handle the extra patients? So what authorities are working on simultaneously is bringing in oral COVID-19 treatments. This drug could be another useful tool in our fight against COVID-19 by lowering the risk of hospitalization and deaths with an easy-to-administer pill. The Ministry of Food and Drug Safety is currently reviewing Merck's molnupiravir for emergency use authorization.